Welcome back to another deep dive. This is where we dig into a pile of sources, pull out the valuable stuff, and really try to cut through the noise so you can feel well informed.
Yeah, and today the source material we're looking at comes from a specific podcast discussion. It was all about different treatments for coccidia in animals, and it spent a fair bit of time on one product, all gone 5%.
Right. So our mission here, based on what that source was talking about, is to clear up some of the confusion it mentioned. Confusion around Algon 5%, Albon, and Corid.
Hmm.
The source actually pointed out that a lot of people are asking things like, hey, is this Algon stuff basically like Albon? Or is it the same thing as Corid?
Yeah, on the questions.
So let's use this deep dive to really unpack what that source material tells us about them.
Sounds good. So first off, what is all gone 5% according to this source?
Well, it's described pretty clearly as a sulfur dimethoxine oral suspension.
And right there, that's a key piece the source emphasizes.
Yeah.
It uses the exact same base ingredient as Albon, sulfadimethoxine. That's what it says. Same active compound, and importantly, the same concentration to 50 milligrams per milliliter.
And its purpose?
It's designed, according to the source, specifically for treating and controlling coccidiosis. They mentioned quite a few animals. Dogs, cats, poultry, goats, the usual suspects.
But here's the big difference the source seemed to really highlight. It's presented as being available without all the usual baggage.
Baggage
like the markup you often see, or sometimes supply chain issues, and crucially, the prescription requirement that usually comes with Albon.
Exactly. The source frames it as something aimed squarely at, say, breeders or maybe small animal owners who need quick access. They want vet-grade quality, but maybe without jumping through the vet visit and prescription hoops every time.
Okay, so that ingredient, sulfadimethoxine, how does it actually work against coccidia? What did the source say about the mechanism?
So it's classed as a sulfa-based antimicrobial. The way it works, as described, is by messing with the folic acid synthesis inside those little protozoal organisms, like coccidia.
Folic acid synthesis. So it stops them from making something vital.
Pretty much. Think of it like blocking a key step in their internal factory, something they need to replicate effectively.
Now, this is where it gets interesting, right? Because the source made a point of saying this makes it static, not cytal.
Yes, crucial distinction. Static means it slows down their replication. It doesn't outright kill them on contact.
Okay, so it pumps the brakes, but doesn't necessarily eliminate them immediately.
Right. And that static effect, according to the source, is why you usually see these longer treatment courses, typically 5, maybe up to 10 days for products like Albon or this Algon. You need that sustained pressure.
And the source did quickly mention Toltrazuril as a contrast.
Yeah, I just briefly noted that Toltrazuril is cytal. It actually kills the coccidia organisms directly. Different approach altogether. So if Algon just slows things down, how did this source compare it directly to Albon and Corid? Did it lay out the differences?
It did, yeah. It was pretty helpful. For Algon 5%, it listed active ingredient, sulfadimethoxine, strength, 50 milligml, effect, static, use, coccidia. And then cost and access, affordable, OTC over-the-counter.
Okay, and Albon.
Basically identical on the technical specs. Sulfadimethoxine, 50 milligml, static effect, used for coccidia. But the big difference noted was cost and access, RX only, and usually more costly.
Right, the prescription barrier and Corid.
That one's different. Active ingredient, amprolium, and it comes as a 9.6% liquid usually, or sometimes a powder. It's also described as static, but the mechanism is totally different. It's a vitamin B blocker.
Okay.
Used for coccidia, yes, and it's OTC, but the source uses the word harsh.
So putting it all together, the source seems to be saying Algon's big selling point is, well, it's Albon's engine, essentially. Same active, same result, but without the red tape. No vet visit needed.
Yeah, that seems to be the main thrust. And then comparing it to Corid, because Corid works by messing with thiamine, vitamin B1, the source implies that's why it can be harsh. So Algon is presented as, let's say, a gentler alternative in that comparison.
Which might matter for certain animals.
Exactly. The source specifically mentioned maybe Polish chickens or some of those really tiny toy breed puppies or any animal that might already be a bit fragile or immune compromised. They might benefit from avoiding that vitamin B depletion effect of Corid.
Did the source give any real world examples case studies?
It did, a couple of them. One was about a litter of Labradoodles, about 5 weeks old. They just had mild loose stool, nothing too severe.
Okay, pretty common scenario.
Yeah. And they were treated with Algon 5% once a day for 7 days.
And the outcome.
According to the source, their stools firmed up and cleared by day 3.
Yeah.
So pretty quick turnaround.
Interesting. What was the other one?
The other involved some really tiny rescue kittens, like only about a pound each, also had diarrhea.
Oh, fragile little things.
Definitely. And they were treated with a dose based on their weight, 25 milligrams per kilogram once a day. Their diarrhea reportedly cleared up by day 5. Okay. And what the source seemed to find compelling about this story was that it was resolved without needing a vet visit or even supportive fluids like subcutaneous fluids, which you might expect for kittens that small with diarrhea.
Right. So if someone listening is thinking about using it, what were the dosing guidelines mentioned in the source?
Okay, let's break that down. For dogs and cats, the dose given was 25 milligrams per kilogram once daily.
Which translates to how much liquid?
A simple way to measure it is 0.5 milliliters for every 5 pounds of body weight. And you give that once a day for 5 to 10 days.
Got it. What about poultry?
For chickens and other poultry, the instruction was to mix it into their drinking water. The rate was 1 milliliter per liter of water, provided daily for 5 days.
Makes sense for flocks and goats.
For goats, it mentioned oral dosing, same concentration, 25 milligrams per kilogram, once daily for 5 days.
And was there any, practical advice on actually using the product?
Yes, one really crucial point. Shake the bottle well before every use. It's a suspension, meaning the active drug particles can settle out the bottom. Shaking makes sure you're actually giving the correct, consistent dose each time.
Good tip. Always shake suspensions.
Now, it wasn't all just positives. The source was also pretty clear about situations where Algon might not be the best first choice, right?
Yeah, absolutely. They pointed out some red flags, more severe cases where you'd maybe want something else, or at least involve a vet immediately.
Like what kind of situations?
Things like seeing actual bloody diarrhea, or if the animal is really lethargic, like significantly down. Also, if you have very small animals, under 2 pounds, showing really rapid onset symptoms.
Okay, so acute severe signs.
Right. Or if you know you're dealing with a confirmed protozoa outbreak that's spreading quickly through multiple animals.
So in those more critical cases, what did the source recommend instead?
It suggested going straight for Toltrazuril 5%. Because Toltrazuril kills the organism, it's cidal. And the source mentioned it often works very effectively in just 1 or 2 doses, which is what you want in a severe, acute situation. Faster action.
Makes sense. But they still positioned Algon as useful.
Oh, yeah. They sort of circle back to say, look, Algon is still presented as a really excellent, affordable tool, especially if you catch things early, or maybe if you're using it preventatively in a situation where Coccidia is a known risk. So let's just summarize why the source thinks people get confused about all these options. It sounds like the core mechanisms are just really different.
That seems to be the main point, yeah. The source kind of boiled it down to Corid works by blocking a vitamin B1.
Okay, the vitamin blocker.
Toltrazuril actually kills the Coccidia. It's the cidal one.
Right, the killer.
And then Algon, or Albon for that matter, works by slowing down reproduction by interfering with that folic acid pathway. It's static.
So slow down, kill, or block vitamins. 3 different ways to tackle the problem.
Exactly. And the source's takeaway on Algon, despite only slowing it down, was that it's seen as very safe and still really effective, provided you use it appropriately, early signs, or preventatively. So wrapping this deep dive up, based purely on the source material we dissected today, if you've maybe been hesitant about looking for alternatives to prescription Albon, well, Algon 5% is presented as giving you that very same active ingredient, the same intended result.
But potentially with faster access because it's OTC.
Yeah.
And likely at a lower cost point.
Right. The source notes it doesn't need a script. It's apparently breeder tested and used by, well, they said thousands.
And they did provide contact info in the source if people had more specific questions. The email was info@toltrazurilshop.com.
And a phone number too, 850-400-3546. We'll put those in the description.
Good idea.
So here's something to maybe chew on. As you think about how you manage health for your own animals, how does really understanding the mechanism, slowing down versus outright killing an organism, how does that potentially shift your strategy when you're choosing the right treatment at the right time?